So this video is on the pneumonia, which means there is an acute infection of the lung parenchyma, excluding the terminal bronchioles, by microorganisms, which cause the acute inflammation of the lungs. So the inflammation of the lungs can be seen, and grossly we can see consolidation of the lung. We'll see what is consolidation in the morphology. And coming to the pathogenesis, the normal lung is generally free of any bacteria because of presence of a number of defense mechanisms at different levels, such as we have naropharyngeal filtering action and mucociliary action of the airways, and presence of alveolar macrophages, which helps in defense, and presence of immunoglobulins, which generally helps and removes the bacteria. But whenever these mechanisms are altered, and also when the microorganisms attack, there is increased risk of pneumonia. So coming to the route of entry of microorganisms, we have inhalational route, whenever the microbes enter through the air, and aspiration of the organisms through nasopharynx or oropharynx, and hematogenous spread we have from the anywhere in the body we have infection, which spreads through hematogenous spread, and direct spread to, when there is adjoining infections. So next, the main causes which leads to these conditions are altered consciousness. So whenever the consciousness is altered, like in the state of coma or cranial trauma and seizures and drug overdose, alcoholism, what happens is the oropharyngeal contents may be aspirated into the lungs, so it can cause pneumonia. And also whenever there is depressed cough, there is decreased clearance of the microorganisms, and whenever there is impaired mucociliary transport, there is normally this mucus will trap the bacteria and helps the macrophages to engulf them. But whenever this is impaired, there is more chances of getting the microorganisms into the lungs, and alveolar macrophage function is impaired. So whenever alveolar macrophage function is impaired, there is no clearance of the bacteria. Whenever there is any obstruction, there is generally accumulation of the fluids, so our mucus, which is stasis, and there is increased chances of getting bacteremia in that. And in immunocompromised state, we don't have enough immunity to compete against the bacteria, so it may cause, or any other microorganism which can cause pneumonia. So this is about the pathogenesis. So next we come to the classification of the pneumonia, and based on the anatomy of the lung which is involved, it is divided into lobar, bronchopulmonary and interstitial pneumonia, whereas the clinical classification is based on the clinical setting in which they get the pneumonia. Like we see community acquired pneumonia, which is whenever there is no exposure to any hospitals about greater than 14 days, the chances of getting bacterial and viral pneumonia from the hospital is less, and it is generally community acquired, means the when we get from the outside the hospitals, like generally. And healthcare associated pneumonia and hospital acquired pneumonia are caused by hospital environment. And next, ventilator associated pneumonia is due to ventilator, and immunocompromised host getting pneumonia, and that is mainly fungal type of pneumonia, and maybe other causes like aspiration pneumonias. And next, coming to the etiological agent which causes pneumonia, there is bacterial, viral, mycoplasmal, fungal, and pneumonia from non-infectious agents. So next we come to specific pneumonia called as lobar pneumonia. Lobar pneumonia is an is caused by acute bacterial infection, and it generally affects the lower lobe of the lungs. So you can see next the morphology of lobar pneumonia. See, there are generally 4 stages in the process, that is stage of congestion. You can see stage of congestion, that is that occurs between the first 2 days of the infection. Next, stage of red hepatization, which is also called as early consolidation. It occurs from 2 to 4 days. And next we see gray hepatization. It is called as late consolidation, which is 4 to 8 days. And next we have resolution, which is 1 to 3 weeks. So if any treatment is not taken, these 4 processes occur. So when you take treatment, these stages are generally are skipped, or it occurs mildly, and the resolution occurs very quickly, like 3 to 4 days. So coming to the each stage, so there are 4 stages: stage of congestion, red hepatization, gray hepatization and resolution. So coming to the first stage, that is stage of congestion, it is due to the early acute inflammation by the bacterial infection, which generally lasts for 1 to 2 days, and grossly the affected part is enlarged, and the lung gets heavy, and it is generally dark red in color, and it is congested. On the cut surface, when we see, there is a blood stained frothy fluid is present. So, and when you see histologically, we can see dilation and congestion of the capillaries of the alveoli, and we have edematous fluid that is filling the alveolar space, and in alveolar space we can see few red blood cells and alveolar macrophages. Okay, and also there are many bacterial particles when we can see when we do gram staining with this edematous fluid. So this is the first stage, that is stage of congestion. Okay, next we have stage of red hepatization or early consolidation. It is called. Consolidation means solid structure. Okay, and it is seen between 2 to 4 days, and it has liver like consistency, so it is called as hepatization. Okay, it is called as hepatization because it has liver like consistency. The affected lobe is generally red and firm and consolidated. The cut surface is seen as red, pink, dry, granular, liver-like consistency, and also we can see there is a serofibrinous pleurisy. Okay, there is mild fibrinous pleurisy, and in the histology we can see clearly the edematous fluid is replaced by fibrin strands. In between them we have macrophages and many red cells. Okay, so the alveolar septa are less prominent in this. You can see the difference. Alveolar septa are more prominent. Here there is somewhat less prominence, and many neutrophils, if you see clearly, there are ingested bacteria when you stain it with different stains, and the next this stage is called as red hepatization, hepatic consistency, and also there is red cell infiltrate and neutrophil infiltrate, many polymorphonuclear cells and RBCs are present. So next, coming to the gray hepatization. In gray hepatization, it is generally called as late consolidation. It occurs between 4 to 8 days, and the lung is firm and gray. It is gray in color, and we can see fibrinous pleurisy in it. In this we can see serofibrinous pleurisy. In this we can see as fibrinous pleurisy. And coming to gross appearance, it is generally firm and heavy, and on cut surface it is dry grain appearance with the liver like consistency, and it changes the color from red to gray. Here it is red, now it is changed to gray, and this color change occurs from the hilum to periphery. Okay, and fibrinous pleurisy is seen. Next, coming to histology. In histology we can see the neutrophil number is reduced when compared to here, and also the red cells are decreased, and the macrophage will exudate. You can see the exudate here. The macrophage starts to exudate, but this exudate is often separated from the septal walls by thin clear space. Okay, so the organisms are less in number and appears as degenerated forms, like the organisms die. And then the next stage is called a resolution, in which we can see there is the restoring of the normal consistency of the lung, and also there is a resolving pleurisy. And in histology we can see there is still some congestion in the alveolar capillaries, and also the macrophages are increased. Here we can see polymorphonuclear cells, but here macrophages we can see, and there is mild fibrosis, and you can see there are some lymphocytes also. Okay, so complications we can see in pneumonic fibrosis, pleural effusion, and empyema, that is the pus in the pleural cavity, and may cause lung abscess and may cause spread of the infection to other areas, like it can cause endocarditis and other heart related diseases also. And the clinical features like sudden shaking, chills, and there is fever, malaise, chest pain, dyspnea, and cough with mucoid purulent expectoration. So we have mucoid and purulent expectoration, you remember this. And also we can see there is tachycardia, tachypnea, and there may be cyanosis, because whenever there is severe pneumonia. So thank you.